Hey everybody, Dr. K here. I'm actually at the Wild Safari at Six Flags today. It's just a beautiful day. Decided to spend a few hours with my wife and come check this out. As you can see, there's some pretty funny elephants in the background. They're actually throwing dirt on each other from their trunks, which is awesome. But I'm actually here talking to you about knees today. You see, I've had a number of requests to be able to tell you guys a little bit more about what you need to do to strengthen your knees and to exercise around that and keep your workouts going. Well, let's start first of all with being able to exercise around your knee joint. That means anything and everything you can do to spike up your heart rate, increase circulation, deliver more oxygen to the muscles, ligaments, bone, everything in that area. The capsule, everything. You want to deliver blood, because if you deliver blood, you've delivered nutrition, which is going to allow a joint to heal. So you want to exercise everything around the injury you can think of, which means if you can do a hip flexion exercise, you should do that, which could also be a trunk flexion, like a sit-up, that kind of thing. At least you're moving, you're spiking your heart rate. You can do any upper body exercise and you'll heal faster for it. If it's your right leg, you can start working out with your left. You can work on single leg squats, things like this. Lunges with barely any weight bearing at all into the back knee. Drop lunges off of a bench. These are all great exercise possibilities for you when you have a knee injury. Now here's the next part. What do you do about the knee injury itself? Well, that depends on which injury you have. Let's assume that it's one of the most common, which would be like a patellofemoral tracking issue, which is like the way your kneecap tracks on your leg. Well, if that's the case, let's start there, and I'll show you a video tomorrow with a couple of example exercises. But the first thing you're going to want to do is get your kneecap to track correctly, which can be done through physical therapy, and if you haven't had success there, then it might make sense to go see another physical therapist, because it really helps to have a hands-on approach with a manual therapist in particular, or somebody that has dealt with athletes in the past, because you're going to be using your knee to work out. Now, secondly, we have to sort of figure out what's going on. Number one, there's probably a persistent amount of swelling in your knee joint. And that swelling, just 3 cc's, just a few drops, is all it takes to neurologically turn off the muscle that controls your kneecap. So that's why it's in trouble when it keeps tracking incorrectly, causing pain, more inflammation. It becomes a vicious cycle. So you want to minimize swelling. Ice, if a leave is okay and you've asked your doctor, something like that might be a decent suggestion. But never do that without asking first, because it can create peptic ulcers and all kinds of complications that I would never want to see you go through. The icing, for sure, you could get started right away, and not an ice pack, but a bag of ice. The second thing is work on hip external rotation, because then you're going to create a bony block. So if you toe out when you squat, you're going to create a bony block stopping your kneecap from tracking incorrectly. I hope this information helps. It's a pleasure seeing you again today. Have an awesome day, and I look forward to showing you a great video again tomorrow. Take care now. Bye.